First in high definition from the station on your side, this is Wavy News 10.
Still ahead on midday, it's pretty tough to watch your sugar if you're having trouble with your vision. Coming up in today's health news, a complication of diabetes doctors say they're seeing more and more.
Back on Wavy News 10 midday. In today's health headlines, November is National Diabetes Awareness Month, and you're saying, well, what does that mean to me? Well, you may know somebody who has diabetes, and it's critical that we talk about it. And we're talking about an aspect of diabetes now that could save your sight. Joining us now is Dr. Samuel Garrett from Virginia Beach Eye Center. He's an eye surgeon, and he has seen just about all of it. I'm wondering how you can tell early on that I have diabetes and that my eyes are affected by it, even before I know there's something wrong.
Right. A lot of people do come and have the feeling that we can always tell when somebody has diabetes or high blood pressure or some other kind of vascular disease by looking in their eyes. And those things do show up in the back of your eyes, but a lot of times not at first.
What shows up?
Diabetic retinopathy is the disease that affects the retina. The retina is the inside lining of the eye. It's kind of like the film in the camera. So diabetes, the whole problem with diabetes is damage to small blood vessels. It's a microvascular disease. So it causes problems with blood vessels like leakage of fluid, like closure of blood vessels, breaking blood vessels where we'll see little hemorrhages in the back of the eye. Sometimes we'll see fluid or swelling in the back of the eye. Sometimes little cotton wool spots where the blood vessel actually closes. There's a little puffy white spot in the back of the eye. That's called background diabetic retinopathy.
Will I have any symptoms while this is going on?
That's the problem with diabetic retinopathy is oftentimes early on there are no symptoms, and that's why it's so important for people to get in and be seen on a yearly basis. Even the insurance companies are now rated, one of the top 10 things that they're rated on is how many of their diabetics actually come in to be seen once a year, because early on there's no symptoms, and that's at a stage where we can still treat and prevent some patients from having visual loss.
Do we know more about the causes of retinopathy and diabetes?
Well, it basically, has to do with the high blood sugar. I mean, that's really the main issue in diabetes is when the glucose goes up, that high glucose or sugar causes there to be damage to the inside lining of the blood vessels. And when that inside lining gets damaged, then the blood vessels can't carry oxygen or food or waste products back away from the retina. And so when those little damages happen, then we see all those back of the eyes.
And when you start noticing the changes, and I start noticing the changes, is there something that you can do about it?
Right. The key thing really with diabetic retinopathy is we see you until you develop some changes of diabetic retinopathy. And then once we see you even more frequently, because then the risk is higher of developing things like macular edema, which is swelling, or new blood vessels growing on the surface of the retina, and we have laser treatment for that condition. We have surgical treatment, and there's even some medications now that are available to help with some of the complications of diabetic retinopathy.
But the best bets now are to eat smart and exercise and stay in touch with your doctor.
It's really a heart-healthy lifestyle is really the important thing, and really just paying attention to your blood sugar is so important.
Dr. Samuel Garrett with the Virginia Beach Eye Center, thank you very much for joining us.
Welcome. Thanks for having me.
And if you have more questions you'd like to make an appointment possibly, you can contact the Virginia Beach Eye Center at 465 North Great Neck Road, or here's a number, 481-5555.